The vital role of clinicians in navigating organizational change. Healthcare is an environment of constant evolution, driven by advances in technology, regulatory shifts, and the growing demands for better patient outcomes. Yet amidst all this change, one thing remains steady: clinicians are at the heart of successful organizational transformation. Why clinicians matter in change initiatives. Clinicians, including nurses, physicians, therapists, and other healthcare professionals, do more than deliver care. They build trust with patients, influence team culture, and understand the realities of daily operations. Their frontline perspective makes them uniquely positioned to spot gaps, advocate for practical solutions, and drive sustainable change. Without clinician engagement, change efforts often face resistance, confusion, or slow adoption. But when clinicians are actively involved, organizations benefit from deeper buy-in, smoother transitions, and improvements that truly enhance patient care. Key roles clinicians play in change management: bridge between leadership and staff. Clinicians serve as trusted messengers, translating the strategic vision of leadership into practical action steps their colleagues can relate to and understand. Advocates for patient-centered solutions. Any change that affects workflow, technology, or clinical practice impacts patients directly. Clinicians ensure that organizational changes prioritize patient safety, satisfaction, and outcomes. Identifiers of barriers and opportunities. Because of their hands-on experience, clinicians can quickly identify operational challenges or inefficiencies that leaders may overlook. Their insights can prevent costly missteps and highlight creative opportunities for improvement. Champions of culture and morale. Organizational change can stir anxiety. Clinicians, especially informal leaders among the staff, can foster resilience, model adaptability, and reinforce a positive culture during transitions. Contributors to continuous feedback loops. Lasting change requires ongoing feedback. Clinicians provide real-time input on how changes are working, or not, on the ground, helping organizations refine and adjust strategies effectively. How organizations can empower clinicians during change. Involve them early and often. Engage clinicians at the planning stage, not just during rollout. Create formal leadership opportunities. Establish clinician-led committees, task forces, or pilot programs. Offer training and support. Equip clinicians with leadership, communication, and change management skills. Recognize their contributions. Celebrate wins and acknowledge the pivotal role clinicians play in the success of change initiatives. Conclusion: in today's healthcare landscape, organizational change is not a nice-to-have, it's essential for survival and growth. But change imposed without clinician input is often short-lived. By embracing clinicians as partners, advisors, and leaders of transformation, organizations can navigate change more successfully, improving both staff experience and patient care along the way.